Hello, this is Dr. Gay from First Lake MRI, and this is a 14-year-old male who is a pitcher, complains of medial sided elbow pain. And we can see here on this axial T1 image that there is a problem on the medial side. This is the lateral side. This is the medial side, and we see that this ossification center here, this is the medial epicondylar apophysis, is not fused. So there's this black line here. This is the physis, the growth plate, and this should be fused. We look on this other side, this one's fused. There's one back here on the olecranon process of the ulna, that's fused. So this one should also be fused, but it is not. There's not much marrow edema. This is bright marrow. Here's bright marrow here, so there's not much marrow edema, and that growth plate is not really thick or irregular. But again, this is not fused, so this looks like it's going to be a chronic injury of that growth plate. We call this little leaguer's elbow, when the apophysis becomes inflamed and irritated, or maybe even be pulled away from the ulna, the humerus rather. And in a case like this, we do see the cortex come down, make a little step off here. And we look on this view here, we see that this ossification center looks like it's displaced anteriorly. So it looks like this may have been an old apophyseal injury where there was a little bit of subluxation, but now it's partially fused back on, but there's no bony fusion, so this is definitely abnormal, but it looks like it's not actively inflamed. So this would be a little leaguer's elbow where there's been injury, it's not fused, but it's not actively inflamed, and there's a little tiny bit of subluxation. But there's another finding that would explain this patient's acute onset of pain, and that is an injury of the ligaments. So this is a view. We're looking at the medial side of the elbow, and we have arrows pointing to the ulnar collateral ligament. This is called the posterior band of the ulnar collateral ligament. It attaches along the undersurface of the shelf of this medial epicondyle. Here's that apophysis. There's no marrow edema within it. It's just dark like everything else, so it's not actively irritated like for an acute little leaguer's elbow. But this ulnar collateral ligament does look like it's actively injured. The UCL is a little bit too thick, and that little white line on the inner and outer sides is a little bit of edema, and then maybe a little subtle bright signal at the attachment to the bone there. So this is a partially torn or injured ulnar collateral ligament, not ruptured, just thickened. If we go to the next slice forward, we see the anterior band looks more clean and nice. This is the posterior band that's partially torn and thickened with a little bit of edema. And there's one other finding. We see some marrow edema over here in the ulna. So this UCL comes off the humerus and comes down to the ulna, attaches on a pointy part called the sublime tubercle, and this is not normal, a little bit of marrow edema. If we go to the next view here, we see the real problem, which is more marrow edema, and we also see this UCL coming down, and instead of attaching nicely to bone, we see that there is a little white line that's fluid. Fluid is white, and it goes right between the UCL and the bone. So this is at the periosteal attachment. This is UCL is torn and stripped up a little bit. So this is a very significant injury in the pitchers. And if they pitch on it, this will really come off even further. And so this is a torn UCL from the sublime tubercle with a little bit of fluid at the attachment. Some of the fibers may still be intact, but it's partially torn. And they usually go do surgery for this. And then again, the epicondylar attachment is also thickened, edematous, and maybe partially torn as well. So a UCL injury in this patient who pitches with reactive marrow edema, injury of the UCL, and also they have this other finding where the apophysis is unfused, so it looks like a chronic little leaguer's elbow. And that's it. Thank you very much.